This is Selma Schimmel at the Multidisciplinary Cancer Congress 2011 in Stockholm. Welcome, Professor Dr. Vincenzo Valentini, to a little discussion here because you are the president of ESTRO, and this is a collaborative effort, this multidisciplinary meeting with ESTRO, with ECHO, and with ESMO. Tell us something about ESTRO.
ESTRO is a European Society for Radiation and Oncology, and is a very well-established society that we share in this moment more than 5,000 members across Europe, and is a society that would like to provide the best evidence to use radiation therapy to cure the patient, to offer them organ preservation, and at the same time to exploit the treatment modality in a multidisciplinary setting. So the reason why we are here in ECHO meeting is just to promote multidisciplinarity, the contribution of high precise, very reliable local treatment inside the scenario of combined treatments.
I would imagine, Europe being the big place that it is, that while the technology is available, that access to treatment may vary based on where patients live.
I have to say you that at the present time in Europe, the availability of high technology that is really important in radiotherapy is quite spread out. So it's possible to find very good opportunity to be treated at the best level in many, many centers. Unfortunately, maybe that access to this opportunity is not uniform across Europe. We have some areas where the waiting list may be not still acceptable, or that the distance between the different small towns and the centers is too far.
What does the European patient viewing this video need to know and understand about radiation therapy?
Radiation therapy is a treatment that has addressed to cure the tumor that is localized, and that can offer the high possibility to cure them with a low impact in the quality of life. It is a really reliable tool, but has to be used inside a frame of multidisciplinary approach, because only in this way the patient can exploit this huge opportunity that new technology offering radiotherapy at the best.
And is radiotherapy also used in the palliative care setting, or if someone has, let's say, spread disease to their bones and pain control?
Absolutely, absolutely. The possibility to cure small volume could be usually applied when, unfortunately, the tumor produces pain and produce impairment of some functionality of some organs. And for such a reason, this is very effective. With a few shots, few treatment, few days, you can reach a beautiful advantage for your quality of life.
And one of the great areas of advancement in the delivery of radiation therapy is the fact that you can spare the skin and the tissues that are higher up and really direct the beam and to attend to the area that needs to be treated rather than scattering it around the areas that don't need to be treated.
Absolutely true. What is one of the major advantages or opportunity that high-tech radiotherapy offers is the integration with the imaging world. Now we know much better where the tumor is, and we can control our X-rays to go only there, sparing the surrounding organs. It's true.
Now, as president of ESTRO, the European Society for Therapeutic Radiation Oncology, what are your goals? What do you hope to achieve for the organization?
Yes, for sure, two goals are in the strategy plan what we would like to implement. One is to increase communication, because we have a huge amount of knowledge and expertise that has to be used inside the society and outside the society in the best way we can. And the second is to have a real priority in how to manage the growth of the society. So what this means, to offer to our young members the opportunity to see in the society a great opportunity for growth, to be valorized, and to bring new idea in.
And I think what is so important for patients to understand is that radiation therapy has become, as you called it, multidisciplinary, that in oncology you have chemotherapy, you have surgery, you have radiation therapy and these modalities, and of course targeted therapies, but that these modalities all are working together on behalf of the patient, and now radiation therapy is used in the surgical setting too.
Yes, I mentioned before that one priority is communication, means that we want to be from the point of view of the patients. So to meet the expectation that the patient have regarding our discipline and to answer to the needs of our patient, we need to collaborate with other specialty to offer them the best.
I think that patients sometimes are very frightened. They don't understand what is radiation therapy, and the machines are very big, can be very scary and intimidating. How do we help patients be less afraid? What message can you share with patients to help them become less frightened of the idea of radiation therapy?
Yes, but first of all, that the reliability of what we are doing is really, really high right now. And the second, what the major effort is for us, for the patient, is that we want really to save the quality of life of the patient. So the treatment, even if it happens in big machine that could sometimes seem like spiders, big new UFO that are around you, but be sure that the technology allows us to control that the invasiveness of our action is very, very, very small, and that we are so very well skilled in targeting the tumor, and only the tumor, that they have to trustful with us. But furthermore, be careful that the radiation oncologist is trained to speak with the patient, to look to their eyes. And so they have not also to be concerned about the possibility to be left alone. We are always close with them.
And the side effects of most treatments as it relates to radiation therapy?
Yes, obviously any treatment has their own side effect. But fortunately, as I mentioned, from one side, the technology allows us to reduce them, and also that the knowledge that we accumulated along the time offer us also the possibility to predict when this kind of side effect could happen to be, as I mentioned before, close to our patient.
Before I say goodbye to you, is there one particular study or any data that was presented at this meeting that excites you?
Oh yes, we had some evidence further that radiation therapy could be very well used to be a reliable partner in tailoring the treatment. So means that it's very flexible to de-escalate the intensification of the treatment when the tumor is very sensible, or to be implemented, incremented in its efficacy, giving higher dose only for patients who need to receive that. So the key message is the tailored treatment is really possible in this new era of high-tech and high multidisciplinarity approach.
Thank you, Professor Dr. Valentini, and congratulations as you now assume leadership of ESTRO. I wish you great success in achieving your goals.
Thank you so much.